Well, an international health emergency is in effect over an outbreak of an Ebola strain in the Democratic Republic of Congo and Uganda. It has killed more than 80 people so far in Democratic Republic of Congo itself, with fears of further spread that are growing when authorities confirmed a case in the country's biggest city of Goma, which is controlled by M23 rebels. Meanwhile, U.S. Centers for Disease Control and Prevention is mobilizing response efforts following an Ebola outbreak in the Democratic Republic of Congo and Uganda, supporting partners withdrawing a small number of directly affected Americans. Earlier, U.S. media reported that a number of Americans currently in the Democratic Republic of Congo are believed to have been exposed to suspected cases of Ebola. The latest development comes as Congo is battling a rapidly spreading outbreak linked to the rare virus strain, a strain that is for which there is currently no approved vaccine. Also, clinical symptoms include fever, bleeding, and multi-organ damage. The disease has a fatality rate as high as 50 to even 90%. The outbreak in Democratic Republic of Congo has so far been centered in Ituri province in northeastern Democratic Republic of Congo, that is near the country's borders with Uganda and South Sudan. Containing the outbreak here is complicated by the constant movement of people. There's a lot of gold mining activity in the province, which also suffers from regular attacks by the armed groups active in this very region.
It is an epidemic that will spread very rapidly, all the more so as it has broken out in a densely populated province, with a high concentration of people and a great deal of population movement. And then, of course, there is the added complication that there are many armed groups in this province. That is what will make managing this epidemic very, very, very complicated.
According to health officials in the Democratic Republic of Congo, at least 88 people have died, while more than 300 suspected cases have been reported. The virus has also crossed borders with Uganda, confirming a related death. The WHO has said that the outbreak did not meet the criteria of a pandemic emergency, but there is still a high risk that the disease could spread further to countries sharing land borders. Experts even believe that fruit bats are the natural carriers of Ebola, though interestingly, the bats themselves do not fall ill. The virus can also spread through other infected animals such as apes, antelopes, and even porcupines before being transmitted to humans. Human-to-human transmission happens through direct contact with the bodily fluids of infected people, including blood, vomit, and other secretions. Traditional burial practices involving physical contact with the victims have also contributed to Ebola's spread during outbreaks. Unlike some respiratory diseases, Ebola does not spread through the air. However, once infected, patients face a very high risk of death.